Hello, welcome to another episode of Autism Corner. My name is Will Urbano, I'm your host. And just to tell you a little bit more about Autism Corner, in case this is the first episode that you've seen, Autism Corner is designed to be an entirely free resource and to be a resource for you to find other resources online, which again are entirely free to help parents of children who are neurodivergent or most predominantly on the autism spectrum and for whom there might be some comorbidities. So today what I'd like to do is just tell you a little bit about an online magazine that I found and which apparently is very well subscribed throughout the world. It is called Autism Parenting Magazine. And again, it's entirely free per the website, which you can find at autismparentingmagazine.com. If you go to the homepage, you'll see a banner which effectively gives you an opportunity to send, it says, quote, "Send me my free magazine now," close quote. So that's a good way to get started in terms of availing yourself of all the information and some of the helpful tips and tools that Autism Parenting Magazine provides. I have just been reading up on the website just a bit, and I did find it interesting that it really does appear to be empirically based and evidence based in terms of the articles that it provides and the recommendations it provides. So, for example, um, right on the Autism Parenting Magazine website, there's a table of contents which, from really the outset, talks about the prevalence rate of autism. And so, for example, one of the sections, which is 1.1, says from 4 to 5 in every 10,000 children in the 1970s were diagnosed as having been on the spectrum. So, again, that's 4 or 5 too many, of course, especially for the parents and the children who were affected. But 4 out of 5 out of 10,000 is a far cry from what it is today, where it's nearly half of all kids in 2025, according to Autism Parenting Magazine, may be diagnosed as being on the spectrum or with a comorbidity of autism. Um, and throughout the homepage on Autism Parenting Magazine, they talk about how 1 in 36 kiddos are identified as being on the spectrum. And just to compare or to show a trend in terms of the prevalence rate, uh, in 2024, as compared to the year 2000, the baseline rate of autism in the community has increased an incredible 241%. Um, that could theoretically be attributed perhaps to a wider um, base or a wider net as far as what could be considered to be within um, behaviors or traits that might qualify one as being on the autism spectrum. But it would appear that that is not the case necessarily, that that there's just a wider diagnosis umbrella, so to speak. Rather, the prevalence rates continue to go up, although there is not any indication that the manner in which the diagnoses are made have in any way expanded. So the prevalence rate does appear to be going up all the time, as it would appear. Um, the Autism Parenting Magazine website also talks about the fact that boys are 4 times more likely to be diagnosed as being on the spectrum than girls. 40% of those who are diagnosed are nonverbal, and nearly half, 44%, of those who are diagnosed on the spectrum also have an average or above average intellectual ability. So, being neurodivergent, these are differently abled children as well. Um, Compare that 44% who are at or above an average intellectual capacity, 31%, so nearly 1 out of 3 of those kiddos who are diagnosed on the spectrum are deemed to have an intellectual disability. They also talk about on the site about how there are some geographic disparities across demographics, specifically where children live. So, for example, um, although it seems like the worldwide average is 1 in 36, in California, the prevalence rate is even higher. It's at 1 in 26. And that is that is compared to, on the website, South Korea is 1 in 38. So South Korea tends to be, it would seem to be almost exactly on par with the worldwide average in terms of prevalence rates. Obviously, California has a significantly higher prevalence rate. And when you compare that to, or when you consider the fact that California represents such a large percentage of the population in the United States, that is an astonishingly high prevalence rate. The site also goes on to discuss how about 36.5% of autism caregivers use ABA therapy, which is the prevalence, or the most prevalent intervention that is used for children on the autism spectrum. And as you may have experienced being a parent who received the diagnosis that your child was on the spectrum, it is very likely that you've been recommended to find an ABA therapy provider who can assist with your children's needs, but also your needs as a parent. And the Autism Parenting Magazine, I'm very happy to see, also focuses on the needs of a parent in terms of navigating having a child on the spectrum. And so, for example, they talk about the difference in some of the needs that mothers and fathers have while being while being a parent of the child on the spectrum, and the support and the types of support that mothers need and fathers need as they go through life with a child on the spectrum. According to Autism Parenting Magazine, who did survey both mothers and fathers, and were trying to get some sense of what they needed in terms of support, it seems that mothers place more importance on the qualities of professionals, a respite from the responsibilities of being, the primary person who is interacting with the child on the spectrum. Parent support groups were ranked very highly among mothers as far as what the type of support that they needed, as well as counseling. The unmet support needs that mothers deemed important included access to treatment and therapies for the child, education relating to autism, help around the house, and involvement in family support groups. So all very positive types of items, and very important pieces of developing a support basis around the child and the family. In contrast, according to Autism Parenting Magazine, fathers place more importance on assistance with the autistic child's or teen's social development. So for fathers, the child's ability to thrive socially was very much at the top of the list. And it would appear that, according to the survey, fathers were thinking not just of the immediate socialization needs of their child, perhaps, as maybe kindergarten age or early elementary school education age, but right through their teenage years was of primary importance to dads. Some of the unmet support needs of the fathers were deemed important to include time for relaxation and self-care, which, whether it be fathers who placed a premium on that, or by contrast, moms who were placing some emphasis on parent support groups, all of the items that were raised as primary concerns by both mothers and fathers, all of them were very important. They're very important for the child, and they're very important for you as a parent. So these are just some of the items and some of the topics that Autism Parenting Magazine can make available to you. And again, you can get a free subscription. Just to remind anyone who has seen prior episodes or who is joining us for the first time, this channel, Autism Corner, is designed and will remain. It is free. Will always be a free resource. This channel is not monetized. It will not accept any payments, and it will always be here entirely for free. There is no money that is being made by this channel, and no money will be accepted. I am doing this because I want to add to the resources that are out there for parents, and to make them entirely for free. And I will continue to do this for as long as there seems to be an interest by parents in finding all of the available resources they can to help their child and to help their families. And with the prevalence rates only going up, it would appear that there will always be a need uh, for any and all support that families should have access to. And Autism Corner will continue to strive to be that resource and always for free. So again, that will be the end of today's particular episode. Thank you for joining. If you like what you've seen today and you'd like to be kept notified of any additional episodes that will be coming up, and they will, with also with additional resources available to you and to point you in the direction of those free online resources, feel free to subscribe to the channel, and that way you'll get notification of new videos that come up as they're published. So thank you very much, and we'll see you next time.